morning and welcome to Health Talk, sponsored by Mon General Hospital. This program is designed to provide education on vital health topics to help you take charge of your health. You'll also be introduced to Mon General's committed physicians, allied healthcare professionals, and quality programs and services. And now, here are your Health Talk hosts, Kay Murray and Jim Stallings.
It's our usual Thursday morning meeting time and place, Health Talk on WHAR, brought to you by Mon General Hospital. Good morning, co-host Kay Murray.
Good morning together again.
And with us today is Tom Cole, representing Fast Care and eScreen. Since we had Tom on last, he's added another area of specialty. We don't know anything about eScreen. Tom, how are you today?
Which is why we do this show.
I'm pretty good. How are you, Jim?
I'm doing just fine. I want to get right into eScreen, and then we want to talk more about Fast Care. But what is eScreen?
eScreen is a computerized collection for drug testing. And one of the unique and very neat things about the eScreen system, it's part of a national network which Mon General has partnered with eScreen to use, and we have 2 locations as collection locations. And through being a national organization, a lot of major companies use them because they can pick sites throughout the whole system. One of the really great things with it is in the retail arena with a lot of quick and often turnaround, they can fill jobs very quickly. If you have a negative result within 15 minutes, an employer can know, and they can almost hire a person and be sure that they're clean and free of drugs in 15 minutes. So it's pretty quick turnaround time.
Has this changed from being drug testing just for safety reasons in companies to going beyond that as well? Because you used to think about, well, okay, if you drive a bulldozer, better get drug tested.
Yeah, it used to be more around the DOT or the Department of Transportation, and if you were driving or operating any type of vehicle, they required you to be drug screened. Now it's gone to a lot of companies benefit through their insurance by having their employees drug screened because it makes for a safer work environment. So it's become a thing commonplace. A lot of the every coal mines in the area drug screens anybody that comes on the property to do any kind of work, and a lot of employers are doing it now because they reap the benefits of not only providing a safe workplace but a lot of times reduced insurance premiums.
Is this by urine or blood or?
It is a urine test, very quick, non-invasive test. It tests. You can pick the drugs you want tested for. We typically use what's called a 10-panel screen, which tests for all the common drugs.
So do people come to you for this, or do you buy them this thing?
No, they actually come to us.
They come to you.
It's a quick process, typically 5 minutes in and out. So.
What type of cost is involved in this?
Well, that varies. Most of the accounts, the ones that are set up through a national account, we serve as a collection site for them. So what they're paying, I have no idea. They're contracted with eScreen. We do it on a local basis with a company, and depending on the screenings that they want, the cost can vary, but it's a very inexpensive process. So it's very cost effective.
Just completely used by businesses, though.
Yes. Yeah, it's totally for business. It's not so grandma can send in grandson to get him screened to make sure he's clean, and
well, why
can't
not?
be doing that.
What are the options for where the tests take place? I mean, do you go into the workplace, or does the workplace bring samples to you?
No, the workplace actually sends the employee to us. And most of the ones that we do are pre-employment screens. You get some occasional random, most of them being pre-employment. The prospective employee comes to one of our 2 sites, and once they have been screened, then the results go back to the employer. We know nothing about the results.
All right. Now, you know that there's some people that are going to try some sneaky things. How do you ensure that they're actually submitting their own urine?
All of our sites are set up based upon the fact that meeting DOT standards. So the collection sites have a restroom that's equipped to do drug screening, so the water is turned off within those. Also, one of the first things that happens when you do a collection, you check the temperature. And if somebody brings something in, it's not registering the proper temperature. So that's the first step of the process.
How's it work? I mean, how exactly does it?
They actually, the person gives a specimen in a cup. If it registers the proper temperature, it's placed into a little testing device. Everything is bar scanned, initialed for as far as for the chain of custody. That way, if there's any legal issues, eScreen, if necessary, provides a medical review officer to review the results if for any reason they think that there is a problem with the results. It randomly does quality checks, so periodically it will tell you to send them off. So you have to send them in, and it wants to make sure that the machine is calibrated properly and they're reading the proper test results. But once the cup is placed in it, and it typically takes about a 5-minute process, it injects down into the urine. It's all through the computer. Once the test is completed, if it's negative, that employer will receive an email back from eScreen saying that that employee's good to go.
Why is this different from other tests that have been done previously?
I think the biggest thing is the rapid turnaround.
Okay.
The fact that the medical review officer is included as a part of the testing and a part of the cost if, if necessary. And it can be customized for the employers. So you can pick the actual drugs you want to screen for. So you could have, there's 3-panel, 5-panel, 10-panel tests. So you can actually kind of customize it based upon your needs.
Is there just a flat rate per number of employees, or if I bring you 200 employees, do I get a better rate?
Well, there again, most of it is done through eScreen as a company, and we become a collection site only. The ones that we're doing on a local basis that the hospital's contracting with, we tend to charge the same thing for everyone, and again, it depends on which panels you want.
But you probably, and this probably isn't a fair question to ask you, but the savings in insurance premiums could outweigh the cost in getting your employees drug tested.
Yeah, from what I understand, it can far exceed that. So,
I still don't understand why you couldn't bring your grandson in and get him tested. I mean, why does it always have to be just through a business? An individual can't use this then.
no, it's actually not for the individual.
Well, you know, we could speculate, which we've done before, but we won't do that on this show. We'll speculate some other show about why you probably shouldn't get your children drug tested.
Okay, we'll do that.
All right.
Because some parents would love to.
We'll take a break and we'll be right back. You're listening to Morgantown AM. Actually, you're listening to Health Talk, brought to you by Mon General on WAJR.
This is Mon General's Health Talk. If you have a health-related question, call us now at 304-296-0041.
Tom Cole, is in this morning, and also we have a Greg Keeley who's chortling every now and then on the program. Appreciate that. I'm sorry, what?
If nothing else, I'm a chortler.
You are.
Nice looking tie today, by the way.
Thank you.
Unlike you. Looks good.
Just got it at the store.
Usually it's
Thank you.
lavender or
I
purple.
hope we can get that on video.
Well, I'll put it on display for everybody if you're interested.
All right,
Again.
We're initially talking to Tom about eScreen, and where are the locations of the eScreen?
We have two locations. One of them is at the Medical Arts Building, which is on Van Voorst Road, off of Van Voorst Road, 200 Wedgwood Drive. The other location is at the new Fast Care Clinic. Well, it's not new anymore. It's been around for a couple years now. We did that as a convenience thing, very close to the interstate. Again, for those national companies that's getting people screened, it's easy access for them. So, and talking about Fast Care, Fast Care is a good option for a lot of the people. We're getting ready, heading into the cold and flu season. They have their flu shots available now, $20. Quick, easy in, no appointment necessary. Again, for some of the minor illnesses, which I'll let Greg Keeley kind of touch on some stuff, Fast Care has been a good option for a lot of patients out there.
Yeah, because I think if your child has a temperature or you decide you need a flu shot, you have to decide, do I go to Fast Care or do I go to the emergency room? When do we make that decision, Greg?
Well, exactly. It's a great point, Kay, because you look at the distinction between cost from an emergency department like Mon General or anywhere else for that matter. We'll just throw Mon General's name out there. But the cost comparison between an ED visit and Fast Care is enormous. Fast Care, maximum charge $52. We would bill your insurance. That includes the lab. If you go to the emergency department, it's going to be maybe 10 times more than that. Mm-hmm. And for a minor incident or situation, it's just not common sense to go to the emergency department where they're trying to take care of a higher acuity of care. Maybe they have heart patients or they have somebody who broke a bone or something like that. For Fast Care, for the minor ailments, it's just easy to go in there and have your needs taken care of. If you have a bladder infection, sinus infection. Sinus infections are so prevalent right now. It started a little bit early. The flu stuff is going to be on the way, as Tom alluded to earlier. So just a huge cost savings that you would have just for the minor things. If it's something serious, obviously you go to an emergency department, but for purposes of minor situations, you want to go to Fast Care. University Town Center, Giant Eagle, it's just right near a check stand, and it's just $52. Includes the lab, and we'll bill your insurance.
And I was going to ask you about the insurance coverage, because some people go to the emergency room because they don't have insurance. Mm-hmm. They'll go into the emergency room. And if we go to Fast Care, it's going to be a lot cheaper for us.
Yeah, exactly right. And another thing, component of that is the convenience of it. If you can't get in to see, say, your family practice doctor, your internal medicine doctor, if their hours are not conducive to your visit, 9 to 8:30 Monday through Friday, 9 to 7:30 on Saturday, 10 to 4:30 on Sunday. You can get in, out, and $52, and you can be out of there in 15 minutes or so.
Mm-hmm. Do I have to make an appointment?
No, not at all. You don't have to call. You don't have to do anything. Just make a quick stop there at the University Town Center, Giant Eagle, and we'll get you taken care of.
How does this help not fill up the emergency rooms? Have you seen the difference in the balance of this, Greg?
Well, you will see that because people have options, as you know, and they go to the emergency department expecting quick care, quick treatment. That doesn't always work out because emergency department doctors and nurses are going to take care of the more serious cases first. If they look at you and think that, well, it's probably just a sinus infection, if there's nothing real pressing, then they're going to take somebody else first. And with Giant Eagle, University Town Center, Fast Care, you get in, you get out without a wait. They say it's health care at the speed of life. And, for working moms who don't have a lot of time and they want to get back to work or whatever, they can get their needs taken care of in a big hurry.
Do they do x-rays of any kind?
No x-rays whatsoever.
That would go to the emergency room. What about drawing blood? Do they draw blood?
Yeah, they do draw blood, and that's a really important point, too. If you look at lab charges for a hospital, more cost involved with that. It includes the lab when you go to Fast Care, and it's just $52 again. And
Tom, you are in Giant Eagle, but you're not near the frozen foods or the bread or
no, not by the
coffee.
Deli. It's up by the checkout counters as you're going out. Actually, if you walk into the store to go to the pharmacy, you walk right past Fast Care. It's next to the pharmacy.
But how private is it?
Yeah, can we watch what's going on?
No, you can't watch. I mean, it's a small setting, but it has a registration area with kind of a waiting room and one exam room. And there's one provider up there at all times. So
I would ask Jim why he wants to watch, but he might give me the answer. So we won't ask that question.
I'm probably be in there and say, "Ooh, look, Kay's at Fast Care. I wonder what's wrong with her."
Yeah, it's
of course,
that blood
everybody
problem
knows.
again.
Yeah.
It's the head, right?
Yeah.
It's mental.
Upper, above the neck area.
From working with Stallings for so many years.
And speaking of which, it does sound like Jim is a bit congested. University Town Center, Giant Eagle, $52.
Yeah.
Where it's only congested at the bottom of the hill, but once you're up in there, it's pretty good.
Well, it's the altitude in Morgantown. You want to consider that.
Yes. All right, Greg. Thank you.
Anytime.
For chiming in.
It's because I care.
All right. We'll give Greg a chance to chortle a little bit more when we come back from the break. If you have any questions, pick up the phone and give us a call at 304-296-0041.
This is Mon General's Health Talk. providing the information you need to take charge of your health. Call us now with your health-related questions at 304-296-0041.
Need a flu shot? Don't have insurance? Or you need some kind of minor health care? They can do that at Fast Care. Tom Cole is in the studio. Also, Greg Keeley. He's with us each and every week, but today he's actually participating in the program. And if you have any questions, 304-296-0041. I was asking you during the break, Tom, about poison ivy. Do you treat poison ivy and bee stings, and are those considered minor?
Yeah, that's some of the things that they do at Fast Care. Poison ivy is probably one of the very common ones in the spring, summer, and fall. We see a lot of poison ivy cases come through there. So, yes, they do treat that. And again, it's a $52 charge. University Town Center Giant Eagle. I mean, easy in, easy out.
Yeah. So again, if you don't have insurance, it's still just $52
maximum.
$52 maximum. If you have insurance, it's going to be your normal copay for a physician office visit. So.
We're a society that we're always in a hurry. We want to get things done immediately. So this is really an answer of not going in, sitting in a doctor's office or an emergency room for long periods of time if it's something minor like this.
And speaking of that and sitting in the emergency room, you know, I believe the numbers are right around 40% of the population on a national basis do not have a primary care physician today. So when they get sick, they have no idea where to go. So typically they're going to the emergency room. So this was a way to offset some of those unnecessary emergency visits, free the doctors up to take care of the sick patients.
Right. This is the time of year where you have young athletes getting into sports. Do you do any type of exams or write-off forms for physicals for young people?
We are doing sports physicals. We have access to any of the forms. Most of them we keep in a file cabinet up there, so even if the student doesn't have the appropriate form, we typically have those. But yes, we do the sports physicals. And typically they do those at a reduced cost. They are not a $52 fee.
So we're saying $52, but it could be less.
It could be less.
In some cases.
Yes.
Like a flu shot or
yeah,
something
flu
like
shot's
that.
a flat fee of $20. They come in, they pay $20, they get their flu shot.
Is there any age where you don't take people, like if it's an infant or young babies, anything like that?
Yeah. Typically, under 18 months, they don't see up there. So if you have a real small child, we're just not equipped to take care of the little babies as far as the exam tables and the things that we have up there because of the space.
Mm-hmm. I just wondered about that because I see your allergies 6 years and older, bladder infections, females 12 years and older, but poison ivy you will go for 3 years.
Yes.
Down to 3 years.
And I know that a lot of people are suffering from allergies right now. I think there's some kind of airborne allergy going. Maybe it's just the regular pollen going along right now. And if we feel that our sinuses are stuffed up or we have allergic reactions, can we go up there, or do we need a doctor's recommendation to get some kind of allergy treatment?
Absolutely, you can go up there. No doctor referral. I mean, you can walk in, no appointment necessary. They'll take care of any of your needs when it's around allergies or something to that effect. If they feel you need a doctor, they will refer you to the appropriate place.
Is there a doctor on staff, however? Is that who actually mans this office?
The office is manned by mid-level providers, either a nurse practitioner or a physician's assistant. Dr. Curtis, who is the director of the emergency department at Mon General Hospital, oversees the operation up there. And they have access to naturally any of the doctors within the emergency room if they feel it's anything that they need assistance with.
You've mentioned flu shots. Do they also do pneumonia, any other type of shots?
Yeah, they do the pneumovax as well. Other than that, they're doing the tetanus. TPTs on site up there. And I believe they're doing the TB skin test now. I'm not real sure about that, but Greg could probably answer that.
Looking at your list of services here, yeah, I've had that. Nope, haven't had that. But more information can be found at 598-CARE, when it comes to fast care, right, Gregory?
That is correct, Mr. Stallings, 598-2273. They'll answer your questions if they can. But really, if you have a minor issue, go on down there and they'll take care of you.
Located at the University Town Center, Giant Eagle Fast Care. And also, you can contact that same number, 598-CARE, to learn about e-screening. That's it for Health Talk today on WAJR.